Hi, I'm Charlie Withington, and I'm presenting on PTLD after liver transplant. Our study looked at the UNOS database and looked at 2,000 children and adults from 1997 to 2023. Our hypothesis was that PTLD exhibits a different prognosis and incidence based on whether it's early or late onset, and that these groups are very different between children and adults. Early onset children do quite well, whereas early onset adults don't do very well, and they have a very poor prognosis. We looked at several baseline characteristics: autoimmune liver disease, timing to onset, EBV infection, and found that these groups are actually very distinct in their clinical features. Early onset PTLD in children is very much related to EBV infection. Of course, children ages 0 to 5 are EBV naive, and thus they're more likely to develop a PTLD that's related to an EBV infection. We found that also early onset children have a PTLD that's related to autoimmune liver disease. So therefore, EBV infection and autoimmune liver disease were found to be protective factors, and this cohort had an excellent prognosis. Late onset children did not share these protective factors. Those who developed PTLD after 2 years in the children's cohort had a significantly worse prognosis, and they were not associated with autoimmune liver disease nor EBV infection. Late onset PTLD in adults, the prognosis was actually fair, and this was associated with autoimmune liver disease as well. So we've shown that in children and adults, autoimmune liver disease is a protective factor. For early onset adults, however, the prognosis is very poor, and these adults have the same risk factors as patients would for classical lymphoma, including advanced age, being male rather than female, and risk factors associated with toxic exposure such as alcohol cirrhosis.